Many employees are at risk of contracting infectious diseases in the course of their work. Those at obvious risk are health workers who come in contact with medical waste, body fluids, and patients who have infectious diseases. Other workers at risk are cleaners both in hospitals and other settings, childcare workers, outdoor workers, those working around or in sewers, those working with animals or birds, first aiders, or just contact with other people in the workplace. Occupational acquired infections can include hepatitis, tuberculosis, HIV/AIDS, and zoonotic infections that can be acquired from animals or birds. Your employer needs to provide you with information on the risks you face. This information should include how infection can be spread, safe work procedures and practices to prevent infection, protective equipment or clothing needed if immunisation is available, the steps to follow if a possible infection occurs. So what can you as a worker do to minimise your risk of infection? Follow safe work procedures. Where possible, avoid contact with sources of infection. This may mean using personal protective equipment or clothing. Practice good personal hygiene. Consider immunisation where this option is available. Clean up any contaminated areas. Keep the work area clean. Make sure that cuts and abrasions are covered and treated quickly. And become familiar with the procedures for reporting contact with infection sources. At the end of this video, check to see what infections you could be exposed to, what procedures are in place for preventing contamination infection, what personal protective equipment or clothing you should be using, and who you can discuss your concerns with.